Could problems with your knees be impacting your pelvic floor function? Well, that is something that we're going to go through in this video. So we've covered a couple of earlier videos where we looked at ankle flexion, hip internal and external rotation. And in all of those different videos, we did some joint mobilizations. Now, it's okay at home to do mobilization of the ankle joint and of the hips, but you should not perform at home joint mobilization for the knees. Research shows that mobilization of the knee joint can be an effective addition to the rehabilitation exercises that you perform. However, those joint mobilizations should be performed by a physiotherapist. So if you have a knee injury or if you have some sort of issues with your knee, it's really good to go to a physiotherapist and to have some assessments done, and they can do whatever manual therapies are relevant for your specific knee. But in this video, we're going to go through a number of different exercises. One of the first things that we focus on is the tibialis. The tibialis anterior, the muscle on the front of your shin, is really important when it comes to knee stabilization, and it's a muscle that is very often underdeveloped in adults. We're going to do some exercises to both strengthen and stretch that muscle. We will also look at the muscles on the back of the leg, so the calf muscles. We will do some stretching and some gentle strengthening of those. And then we're going to look at some of the other muscles that support the knee. Ideally, we would begin with focusing on the tibialis anterior, so the muscles on the front of your shins. However, many people have tension in the calves at the back of the legs. And what this can mean is that when you go to do your tibialis raises, you may feel the tension in the back side of the leg rather than feeling the activation in the front side of the leg. So we're going to begin instead with stretching the calves and strengthening the calves a little bit before we turn our attention to those key muscles that we really need to work on. So you're going to come to the wall. And we're going to start just with a little bit of stretching. So we're stretching on the back leg. So just put the leg back a little bit and lengthen through that leg. So you want that leg to be straight. Try to keep the heel on the floor and just send the hip forward a little bit. So you're really pressing into the heel on the floor behind you, and you should feel the stretch just along the back of your calf. So just doing this little stretch on one side for 1, 2, 3, 4, 5, swapping feet. 1, 2, 3, 4, 5, and again. 1, 2, 3, 4, 5, and once more. 1, 2, 3, 4, and 5. And then we're going to do some little calf raises from here. So we can do both at the same time. So you're just going to come up on your tippy toes for 1 and lower down slowly. 2, lower down slowly. 3, lower down slowly. 4, lower down slowly. And 5, lower down slowly. Just give the legs a little shake. Now you can do these with a slight elevation so that you get a bit more of a stretch at the bottom. But for now, we're just going to start with this. So 1, lower down slowly. 2, lower down slowly. 3, lower down slowly. 4, lower down slowly. And 5, lower down slowly. Okay, now we're going to come around and do a little bit of strengthening of the tibialis. Now the tibialis is a muscle here, and maybe I can show you how it looks when it is activated. So if you look here, you will see the muscle actually pops out a little bit when I lift up my leg. I've trained quite a lot of the tibialis, so you can see that there is some, at least, muscle there, and you can see that there is some activation when I lift up my leg. So we're going to start with one leg. Now when you put the leg on the floor, let's say we start with the right. When you put the leg on the floor to do the raises, if it feels really uncomfortable there, you can actually take it a little bit closer and you can do it from here. So find a place that's good for you. We're doing dorsiflexion when we lift the foot up, and that dorsiflexion is contracting the muscle here on the front of your leg. So Let's lift and lower. 3, 4, and 5. Swapping to the opposite leg. 1, 2, 3, 4, and 5. Go again on the opposite side. 1, 2, 3, 4, 5. And one more time. 1, 2, 3, 4, and 5. So the next thing that we want to do is to actually stretch the tibialis a little bit. And there are multiple ways that we can do this. We're going to start with just a simple seated version of the stretch. We will start with the left leg. So just bring the left leg underneath the chair and rest the top of your foot down. And this will give a very gentle stretch. And you can hold on to your hips here as you relax. Just make sure that you're firmly seated on the seat. You can see that you have to be sort of a little to the outside of the seat and you don't want to slide off. So make sure that you're safe with all exercises. So we're just going to hold this for a few moments. And then we're going to swap. Do it on the opposite side. So holding for a few moments, just relaxing, taking it nice and easy. Spine is neutral. Swapping to the opposite side again. And again. Beautiful. One of the things that we're going to do is work for a little bit of knee stability when it comes to the abduction of the hips, so the opening of the hips. And it is your glute minimus and medius along with some other muscles that are responsible for that motion. For this, I'm going to use a little stretchy band that I can just put my feet into. If you don't have one of these, you can put a belt around your legs and you can press into the belt. It is not quite the same, but it is in effect the same. You're adding tension. The way that when you press into the belt, you will activate these muscles. And these are little activations, little muscles around the hips that actually do have an important role when it comes to knee stability. If you suffer from your knees dropping in, then strengthening up these muscles will help to hold the knee in that nice neutral position. So let's put the band around the legs. We're going to take the legs just a little bit wider than hip distance. You can hold on to the side of the chair and we're going to just open and close. Open and close. Open and close. Open and close. And you feel that little activation as you do this. This is a nice easy way to do your abductor exercises, just sitting here. But control. So open quickly and control it coming slowly. Don't let the knees spring all the way back in. You want to keep them coming just so that they're back in line with the hips. You don't want them to come all the way in. So keep the control so you have tension against the band the whole time. And if you're using a belt, just press against the belt and then relax. Press against the belt and then relax, but don't let your knees come back to the center to touch. You want to keep the knees apart. And that is going to really help with building stability around your knees and giving you the ability to take all of your normal movements without compromise to your knee joints. So now we're going to do a little bit of work on a squat with a single leg, but the focus is knee stability. And you can have a couple of yoga blocks available for this. We'll start with just one block and then we can add a second block if needed. Now, one of the most important things for the setup is that when we're going to stand on the block with one leg, and when we stand on the block, we're going to do some squats in this position, but it's important that you don't try to send your knee forward without sending your hip back. What we're really going to do is hinge at the hip and then bend the knee, bringing the heel of the opposite leg down to the floor. So we'll do 1, 2, and you should feel the glute active. 3, 4, 5, 6, 7, and 8. Now, you shouldn't feel pain around your knee when you do this. One of the key things is that hip hinge. So you're not trying to send the knee forward. What you're trying to do is send the hips back. So in effect, what is happening is that your center of gravity is remaining over the middle of your foot. So you're not trying to send all the weight forward and dumping a whole load of stress into the knees. You're not also trying to send your weight too far back. You're trying to maintain balance. And it takes a lot of effort for all of the muscles around your knee to stabilize when you do this. The knee should be, as you're hinging, the knee is going forward a little bit, but it shouldn't be going all the way forward. It shouldn't be going in or dropping out. It should just be staying in line with the leg. Now we do the same on the other side, so coming onto the opposite leg. And again, we hinge at the hip before we make the movement, and that hinging at the hip is going to allow us to turn on the glute at the back. 4, 5, 6, 7, and 8. And it is a little bit of a challenge to balance on the block. If you have a lot of issues with balance, you can use something like a broomstick so that whenever you're doing these, you have something to hold on to. But I really encourage you to use the glutes to do the work, to use not so much effort to hold. Like, you don't want to be dumping all your weight into the stick. Really what you want to be doing is actually using your glute muscles to stabilize your body as you hinge at the hip going up and down. You'll feel a really good activation in the backside, and you should then develop a little bit more stability around the knee. Now, if you felt okay with that, we can try with another block. So having 2 blocks is giving you more of a challenge. It's going to place you a little bit higher. So again, if you need stability, if you need something to hold on to, if you don't have balance, then you can take something to hold on to. So remember, before we start, we want to hinge at the hips, which just means basically we bend at the hips, and then we're going to bring the heel down. 1, 2, 3, 4, 5, 6, 7, and 8. Then swapping to the opposite side. Again, finding your stability before your balance, before you start, and then hinging at the hips. 1, 2, 3, 4, 5, 6, 7, and 8. Now, this IKEA stool can be a helpful addition when you want to progress, because as you can see, it's like another block high away from the floor. So we just put the blocks aside for a moment. So if you were going to do this, the other thing that I like is that you can actually have a little bit of support. So you can have your leg against the step when you do the exercise. And you see then there's a lot more work. You have to hinge a lot deeper. You get a much deeper flexion in the knee when you come down. You have to really work the glutes a lot harder to get you back up again. So this is quite a challenge. And when you do the exercise on the opposite side, again, you can have that support as you come up and down. And this is a really great challenge. And if you really want to step it up a whole notch, you can do it from the top, but this is much, much, much harder to do, more difficult to get the foot all the way down to the floor. So it's probably better not to be doing that height, at least to start with. So work from where you find your body. Do a few sets, so maybe 3 sets of 8 when you do your practice. This is going to build quite a lot of stability around your knee, which will help significantly with overcoming knee issues that may be impacting your pelvic floor. So you have muscles both above and below the knee joint that help to support the knee. Now, one key aspect that is really important when it comes to knee rehabilitation is rehabilitation for deceleration. So that's when you slow yourself down. So it's, again, something that we don't often do is walk backwards. So we're going to do some backward walking, and we're going to add some weight with our backward walking. This should help quite a lot when it comes to stabilization of your knee. In turn, that should have a positive impact on your pelvic floor, because you're going to be able to get into many different positions that are helpful for relaxing or for strengthening the pelvic floor that require that you have good mobility and good range of motion around your knee joint. It's important before we take our steps backward that we make sure that the space is clear, so there's nothing in the way that we could possibly trip over or bump into, and we should count the steps going forward to make sure that we know how many steps we can safely take in order that we don't walk back into something. So let's start with that. 1, 2, 3, 4, 5, 6, 7, 8. So I know I can take 8 steps safely without bumping into anything. 1, 2, 3, 4, 5, 6, 7, 8. Turn around. 1, 2, 3, 4, 5, 6, 7, 8. Turn around. 1, 2, 3, 4, 5, 6, 7, 8. Turn around. 1, 2, 3, 4, 5, 6, 7, 8. Turn around, and we do one more set of these. 1, 2, 3, 4, 5, 6, 7, 8. Now that we are able to take some safe backward steps, if that all felt okay around your knees, then you can add some weight. So I'm going to improvise, as I'm not in a gym and I don't have the proper equipment for doing backward weighted walking. So I'm going to improvise using my weight belt that I use for the gym, and I'm going to just add a strap to pull some bolsters. So you can be innovative in whatever method you come up with to drag something along. If you have kids and a suitcase, you could open your suitcase and put them sitting into the suitcase and drag them along. I think that could be a really fun way for them to have some fun and for you also to train your knees. This is my weight belt, and I use this at the gym if I'm doing very heavy lifting, because it gives me something that adds a little additional support for my back and also allows me to perform the Valsalva very easily. So if you have one of these, you can use it. The reason I like this for any exercise where I would be pulling is because, as you can see, it has quite a wide back. So when I put this on, it is going to spread the load. So if I was using a standard belt, then the weight as I pull it would be on a quite narrow place, whereas this is going to allow me to spread the load across my whole back. So I have a 3 kilo bolster here, and what I'm going to do is I'm going to take a yoga strap, and again, this can be a rope, can be any kind of belt that you have available, but the yoga strap is really ideally suited because it has this nice loop and you're able to adjust it. I'm going to bring the yoga strap around this, and I'm going to also put it in here. So feed it through, and then I'm going to be able to tighten it up, and that gives me something that I can then pull against. And it's not very heavy, 2 or 3 kilos. Could add a second bolster. You could add something else. I mean, you can go to the actual gym and they have belts like this with specific equipment that allow you to pull weights in order that you work your muscles in a slightly different way. But for the purpose of this exercise, I'm just going to drag this bolster along the floor and we'll see how that goes. I'm going to start just walking backwards. 1, 2, 3, 4, 5, 6, 7, 8. I'm going to take my weight, turn around, and go again. 1, 2, 3, 4, 5, 6, 7, 8. And this isn't so much resistance, but it's a good starting place. I can feel that I have to work a little bit harder for this. So making sure that you don't walk into something. Be careful as you do this. Don't use a weight that is too heavy for starting out. And I'm going to add a second bolster to increase the intensity of this exercise. So with the second bolster, I have a little more work to do. This is a little better if I think about the intensity that I want to train at, then this is a little better. This is definitely working the legs a little bit more. Now, another very good alternative is to walk backwards on a treadmill on an incline, because that gives you the intensity that you need because you're walking backwards up a hill, and it also allows you to do this for longer without all this turning around, and also without having to drag bolsters around the floor. You have multiple options available to you when it comes to this deceleration training, and this will help with your knee stability quite a lot.